All right, thank you all for joining this morning. I appreciate the opportunity for you all to come in kind of at one time versus everybody kind of asking for time throughout the day. So I appreciate that. I just have a few remarks, and then I'm happy to answer any questions you might have. So I just want you to know, as we have been really tracking the measles across the United States and here at home in Nebraska, we knew that it was just going to be a matter of time before we had our first case here in Lancaster County. And as you know, and I shared in the press release, we've not had a case here in Lancaster County since 1990. So we did get a confirmed case late yesterday afternoon. The person is an adult who was appropriately vaccinated and had no out-of-state travel history. So we're working very closely with the Nebraska Department of Health and Human Services. Just a reminder, we want people to know that measles is a highly contagious disease that's spread through the air by breathing, coughing, sneezing. And it is possible that residents who were in the same location as this person may have been exposed. So as a reminder, we have two locations, the Walmart on North 27th Street, 4700 North 27th Street. Specific dates and times, January 18th between 1 and 3:30 p.m. And then the Meadowleet Urgent Care located at 7120 South 69th Street on January 25th between the hours of 1:30 and 5 p.m. So if people were at these locations, we asked them to fill out a risk assessment survey that's available on our website at lincoln.ne.gov/measles. They'll also want to check their vaccination status and watch closely for signs and symptoms of measles.
What's the level of worry with families in Lincoln that are most vulnerable to measles?
So I get very concerned about the little ones that are not old enough to get vaccinated. So that's anywhere from birth up till that 12 months of age when they can get that first vaccine. Sometimes individuals that are immunocompromised, if they don't build up that immunity, they just want to be cautious of that. Anybody that's more vulnerable as far as the senior population, the very young. So there are some populations that we get a little bit more concerned and worried about.
Can you talk about the secondary risk with measles? It destroys your immune system and then leaves you susceptible to other things.
So I get very concerned about, because this disease is highly contagious and can really increase the kind of the medical or the health implications. If you take a look at the statistics across the nation with measles, we're seeing a high rate of hospitalization, severe illness. You can have everything to the worst case where we have people that have died. So in 2025, there were 3 individuals that died from measles. And so that hospitalization, long-term, it could be hearing loss, could be just any plethora of kind of impacts if you think about just the extent of the measles impact to that individual.
We were talking to a daycare this morning, and their question was, is the rash the first sign? Because they see runny noses and cough and sneezes most of the year.
That's a great question. And especially around this time with respiratory illness season, measles starts off with what you would think might be a typical cold or flu, runny nose, fever, coughing, congestion. What will be the telltale sign is the rash begins to develop either on the head and works its way down, or it starts on the chest and kind of works its way up and into the arms. The rash can be kind of flat, but it also can develop to raised areas. It just depends on how you're responding to that virus.
There's a request that people quarantine for 21 days. Why is that?
So anyone that was exposed and unvaccinated, so those two things, we asked them to stay at home for 21 days and then just monitor their signs and symptoms for measles. And that 21 days is really the incubation period. For some, it could be 6, 11 to 12, as much as 21. So really that 21-day sweet spot is what we want people to just stay away, isolate at home, and watch and monitor for signs and symptoms.